Hello guys, welcome back to Young and Sweet. This is another episode 5, and your host today is Josephine. And as you can see, we have balloons, blue color. So this is Blue Month, which is World's Diabetic Month, and the day is commemorated on 14th November. So Newton, can you tell us a little bit about this day and this month?
Thank you, team. Welcome back to the Young and Sweet podcast. My name is Newton Gogi. I'll also let my colleagues also waweze kujiintroduce. Stella.
Hi everyone, my name is Stella. Back again at this Blue Month.
Hello, my name is Steve. I'm thankful to be back here with you.
Thank you. Yeah, so we have balloons. Now these balloons are very simple. It's a message to the world. We are doing the Blue Challenge. So November for us is not normally it's called the No Shave Month. But for us people living with diabetes is the World Awareness Month for Diabetes. And today we want to explore and discuss more about this Diabetes Month. So for this particular session, we'll also have some challenges ambazo tutaweza kushare na nyinyi trying to balance this balloon. So ukiona sisi tukiwa na balloons hapa, take this balloon as diabetes, whereby we are trying to balance our blood sugar. So blood sugars at times unajua vizuri pia Josephine huwa zina fluctuate. Unapata iko juu wakati mwingine iko chini. So assuming you are living and then you have a balloon by your side, how will you be able to manage that condition with for example, so the balloon is a symbolism tunajaribu to represent, ndio? So we will also take care of the balloons. Hopefully hakuna ita burst tukishoot the podcast. So we also have that. So for me, this World Diabetes Day, the reason we commemorate it is at least we have a slogan and also we have a theme, ndio? So the slogan is
know your risk, know your response.
And then the thing is
access to diabetes care.
Yes. So well over 100 years ago, Josephine, kulikuwa na invention. Na hiyo invention ilikuja kwa sababu watu waliweza kujua there is an insulin. Na hiyo insulin ile tunatumianga kujidunga wakati we want to stabilize our blood sugars. So for anyone out there who's wondering why we are so much endeavored kwa hii activity, kwa sababu we want to create awareness. But then vile tulianza the Young and Sweet podcast to realize within November hiyo month activity nyingi sana zinakuwa za diabetes, but tukifika November that is ikiisha, people go to factory settings. That's why tukaanza Young and Sweet podcast and we are in season 2 currently tuweze ku explore that much, ndio? Yeah, for Steven, so if you are diagnosed with diabetes, in the previous episode ulituambia you are diagnosed in 2020, which was the first time that you were able to also come out during these commemorations and celebrate the World Diabetes Month. Yeah.
Tuseme sikukuja hiyo that year bado nilikuwa na activities mingi kwa zingine zilikuwa kwa mind.
You are still processing.
Nilikuwa na process bado. Zilikuwa tu ziko to kukikuwa na nilikuwa natokea kama wakati wenye nasema tuna celebrate, tuna screening nini, nilikuwa tu najitokeza tu, lakini kama nimejificha tu chini.
Yes.
Ile ya downtown. Yeah. Sikuwa na nini sana. So nilikuwa na ile diabetic day, tuseme mimi nimenini kwa nyumba. Na celebrate napiga
silent followers.
Napigia tu mko aje. Mko fine, mnasikia aje? At least najisikiza. Nilikuwa na celebrate
kivyako. Yeah. Stella, World Diabetes Day, what activities do we anticipate to see in the community? And then nani Josephine atatuambia pia in support group what activities do they have and or anything.
Okay. So mostly sana in my area ama in health sector.
Yes.
Mostly kunakuwa na walk. And this walk sana we try not to engage only the patients, in this case, or the people with the condition, but also everyone who is available. Because now for this month we are saying access to diabetes care with the slogan know your risk,
know your response.
Yes. So it is good when we invite all the community so that they can know the risk, because now actually the researchers are saying by 2030 everyone will have diabetes. So I think engaging in various activities like now the walks, counts.
Physical activity, creating awareness, right? Sindio? Yeah. So Josephine, for your case, with your support group that we have, and what activities maybe do you do to maybe commemorate such a day? Do you have, for example, support group meetings? Do you engage with the health professionals? Do you work also with the government to try and bring? Maybe you can speak on that.
Okay, so according to the slogan is know your risk, know your response. Yes. First, I'm going to talk about the risk. So the main risk factors for diabetes is lifestyle, physical inactivities, excess use of alcohol, among other factors. So as for us as a support group, we have already started screening, massive screening around our area. So we started it last week. So we are doing risk. You remember that diabetes and hypertension, they are silent killers. So you might be having it, but you don't know. So one thing, we are creating awareness. We tell people about the signs and symptoms, and we are doing more of education, because hakuna mtu anataka kupima. Most of the people have the
fear of the
unknown. The fear of the unknown. So what we are encouraging, kama uko karibu around Westlands constituency, you get us Apple Sarit Center next to Old Safaricom House at Westlands Hospital. We are doing screening for free. Come, know your status. It only takes 5 seconds.
5 seconds, right?
Yeah.
And 5 seconds can save a life, right? So when we are saying that know your risk, know your response, at the end of the day, we want to help you so that we can be able to reach more people. Statistically, the people living with diabetes in the world is 500 million. So kama ni inchi, if it was a country, it could have been the third most populous country, because the first would have been China and India. So that's a very huge demography for people living with the condition. So if you do not live with the condition, you know a person who is living with the condition. Most probably, you should take care of yourself before you become a part of that statistics. And what are we saying sisi ambao tuko kwa hii space? We know the risks. We have the response to cater to you. It is now for you to take that initiative to come on board with kufanya nini. We give you the education, we do the testing for free, of course. For free, Josephine. For free, sindio? So that at least you can have that. And ideally, mtu ambaye hana hii condition, it is advisable you take your blood sugar test once in a month, sindio? So for Steve, in terms of the World Diabetes Day, what does that time mean to you? Do you have a sense of, because the blue is the color, sindio? So what part of do you have an attire for blue? Kuna ile nguo unapenda kuvaa hiyo wakati ya blue ama kitu kama hiyo?
Tashona kisuti hapo.
Atashona suti ya blue. Ama ununue socks za blue.
Okay, as for me, mi naonanga ile personally on a personal level, mi sionangi ati nguo ama nini ikiwa ina make much of an impact. Ile kitu yenye na making impact ni ile yenye iko ndani yako, yenye iko kwa hati yangu, yenye iko kwa mawazo yangu. Nimeifix, nimesema this is a day nafani juu the main aim ni ku reach out. Juu mimi nishajua hali yangu, so I need to encourage others pia at least waende wapimwe, lakini saa shida ni moja. Tukienda ukiambia mtu, watu wako ignorant. I think hiyo inafaa kuwa tukiweka kwa zile risk factors, ignorance inafaa yako pale. Juu ukiambia mtu the importance of this thing, so wengi wanakuambia wacha tu kitu yenye ujue hawezi ikaniua. So tunataka tutoe hiyo mentality, at least uiweke, enda ujue ndio uanze kujipanga. Ukipata uko nayo uanze kufuata the steps accordingly. Ukipata huna, at least utajua mwingine mwenye ako na. So at least tukipea hiyo information, ikiwa reach out, at least pia unajua ukireach mmoja na yeye ana reach mwingine. Inakuwa
it's a kind of a paying forward, right?
So ni kama umbrella, sasa ukiweka hapa inafunika huyo mwingine, ni kama umbrella. Sasa wakati wa jua ukifunika huyo, na anafunika huyo mwingine. So tukipatana, at least nikipea wawili, at least najua itafikia mwingine. So that is the main aim, at
the main aim, right?
Alafu Newton, another thing, like when we are doing the screening, unapata like wale wengi wanakuja kupima ni from the age of 40 and above. Hata mtu akiwa na mtoto, ama if a young person also want to be screened, nasikia mtu anakuambia wewe huwezi kuwa nayo, wewe ni mdogo. But what I will encourage the community, like even the children, to encourage everyone to be screened. There are two types of diabetes. There's type 1 and there is type 2. Type 1 ni young people,
Yes.
young people, and type 2, it's
of old ones.
it
Like
comes
advanced.
it's
With advanced age.
it's for advanced age, but anyone can get. According to your lifestyle.
Yes.
It's a lifestyle disease.
For sure.
But for type 1 it's not a lifestyle disease.
Yes.
That's a rare condition. It's autoimmune.
And it can get you at any age.
At any age.
So it's also very, very important. And for sure, the way just so what risk should we be looking out for? The risk number one that we should be looking out for is alcohol consumption. I don't know where this came in, but all of a sudden it became a sherehe nation. So whereby like everyone is consuming alcohol. You should limit your alcohol consumption because at some point it predisposes you to the diabetes and hypertension, right? And then secondly, kuna the unhealthy diets that we have, sindio? So unhealthy diets is chakula ambazo.
Talking about unhealthy diet.
Yes.
Because now it's a whole
and lucky for us as Young and Sweet, we have professionals. So for Stella here, our beloved nutritionist, expound just a little bit, like in 2 minutes, about the health aspect and diabetes.
Okay.
Yeah.
I think now when we are talking about the risk of diabetes,
Yes.
the number one risk we should all fear, it is diet. Before even we go to alcohol.
Yeah.
Because right now what you are consuming, it is not even the junk, but even whatever you are taking in the house. You'll find maybe for me, I'm taking a whole ugali. When I'm saying about a whole ugali, nile ya kusiaga, si ile ya brown. At least for nowadays, we are trying to embrace hakuna diabetic diets.
For sure.
Because for me, I usually tell my clients, if there is a diabetic diet, it means if I have diabetes, when I take this diabetic diet, I'm supposed to na heal too, sugars too zinakuwa sawa. But now what we are saying, it is a healthy living. A healthy living inamaanisha we do away with the refined and processed foods. Refined processed foods, hizo ni chakula zenye ziko kwa packet, ziko kwa mikebe, because they have a lot of sugar. And whatever is happening, tukikula hizi chakula, let's say nimezoea, especially here in Central. Sahi mahali penye niko, nimekuwa challenged, those people tu chakula yao ni mboga, alafu kama ni ugali ni ya kusiaga. Hakuna kitu ingine. But ukikuja Central, it is very sad, unapata hata ukienda hizo foreign counties. Watu wenye wanakuja clinic na diabetes ni Wakikuyu. It is very sad because of why? Sisi tunajua mahindi hata ukitoa kwa shamba, unaenda unasiaga na unamwambia nataka number 1. Number 1, it is purely refined. So hapo unapata the only thing we are taking, it is pure sugar. Na makio asubuhi nimeamka, nikakula ugali na chai. Then saa 4 nikasema niko njaa, nikakula mkate na chai. Na chai iko na sukari. Then during lunch time nimekula githeri ama mchele na waru. Then saa 10 nikakula ndoma na chai. Jioni nimekula tena matoke, mandizi na viazi. So at the end of the day, mimi kama Stella consume a lot of sugar, because basically tunasema hiyo chakula nimesema ni carbohydrates. Carbohydrates, after the processing of the process of digestion and absorption, tunapata ni glucose. Na glucose ni sukari. So unapata at the end of the day, mimi sukari yenye nimekula ni kama nimekula 2 kg of sugar hivi tu na kijiko. What happens after umekula? Imeenda
kwa bloodstream,
imeenda ikakuwa siko kwa glucose, iko ikiwa glucose na lazima itembee into the cells. But now ni mingi, mwili haiwezi tumia yote, the whole glucose, so inachukua kidogo and then the rest it is being converted to fat. Sawa. At the end of the day, napata insulin resistance, which is type 2 diabetes. Sawa. So unapata ni kila siku venye unakula. So what we are saying, hata wewe ukiwa na diabetes, acha kusema ati mimi nakulanga ugali ya brown, ugali ya yellow. Wengine wanasema sijui waliambiwa wakule nini, alafu the rest of the family waendelee. No, for me what I would say, let us embrace kukula to health. Healthy inamaanisha if it is ugali, wacha nikule hii whole yenye nimeenda nikasiaga number 2 yenye jatolewa hizo mangozi za juju, and then nisikule ile. Unajua sasa tunakosea, unapata kama Newton ni tuseme for example, sijasema wewe ni mzee, tuseme sasa Newton is my husband. Unapata nimepika ugali alafu half of the ugali ni ya Newton,
ni ya mzee,
lakini mboga ni sosa kidogo. Unapata unakula ya kuguzisha, alafu akimaliza mboga anasema nipe chai niendelee. So hiyo tu ni skari. So tuzoee, it is not a must I take a whole plate of ugali ama a whole plate of duma ama mchele ndio nishibe. You can modify your diet. Hata saa zingine ukipika kitu kama beans, ndengu, lentils, njahe ama nyama, kula without the starch. Kula tu like starch ya nini, because even the ndengu, the beans side tunasema iko na starch. So kula tu hivyo na mboga with a lot of vegetables. Sawa. So the trick is eating a lot of vegetables. Tunajua hata mboga iko na fiber. So nikikula mingi nitashiba, sitakula sana. The slogan of eating frequent meals. Tuache hiyo. Unaambia mtu wa diabetes kula chakula kidogo mara mingi. Josephine, what happens? Mgonjwa mwenye amekuja kwa clinic akakwambia niliambiwa nikule kidogo mara mingi. Sana the sugars atakikuja hazikuangi less than 10. Sawa. So I think pia it is us kama healthcare providers, what are you telling the clients? Sawa. Before at least you engage with your client. Si ile ati umegoogle, umeangalia eat he. Hapana. Sit down with your client. Clients are different. Manage your clients exactly. Sawa. Ile chakula yenye anapata nyumbani manage nayo. Sawa. Na ya kusaidia.
It really makes a lot of sense, and we will have an episode on nutrition very, very soon on the next episode. Kindly check us out on our social media handles, Young and Sweet Podcast on YouTube, Young and Sweet on TikTok, Young and Sweet Podcast on on Twitter, that is known as X, and also Young and Sweet on Facebook.
Yes, because when we talk about unhealthy diet, that's the main factor. Kwanza ukiangalia like even the frontal pack labeling of all the foods, na sana like you find the junk food ambazo ziko kwa super, how they are packed zinaenda kuentice the children. They are targeting the children. So in the coming years we'll have NCDs zimejaa, diabetes, because whatever children wanakula, consuming, and ukitembea kidogo hapo utapata there is mali kunauzwa chicken, pizza, like unhealthy food is everywhere. There is a lot of advertising, like full network food industry, iko na pesa. So we need to talk about that in the next episode.
We are going to talk about it in deep.
Yes. So the other bit pia ya risk ni pia exercise, physical activity. Our colleague also Brian is engaged elsewhere. Alikwambia kuhusu gym. So physical activity is just those simple tasks zile unafanya nyumbani, si ndio? So if you can do an activity and then you feel like your heart is in a risk kidogo na umebreak a sweat, just do something out of the ordinary. Just walk maybe from stage to where you are living. If you take lifts for that particular day or 2 days in the office, just take the stairs, ndio? Avoid the elevator kitu kama if you're not in a rush, that is sawa. That reduces your chance of getting type 2 diabetes, right? The other bit of that is also in terms of maybe family history. So you can even check your family history and see if there is that kuna ile 1 or 2 people who are living with the condition. Just ensure that you have those risks very well cut out. If you are going to the checks, routine checks, I understand most people don't go for routine checks. So just go once in a year, have your blood pressure checked, hata kama uko sawa, because some of these vile umesema ni silent killers, ndio? And then I know people are wondering why is it that we commemorate that day on 14th November, but apparently 14th November is the birthday of the people that invented the insulin in in Canada. So the insulin is what we use as people living with diabetes, because our insulin, we either suffer from insulin resistance or insulin deficiency. So as we wrap up, and we will be doing this and more challenges as we check our social media handles, what is the potential that you have for people living with diabetes, Steve, and also for the healthcare providers, and then for the government to be able to ensure that people living with diabetes access high quality of diabetes care?
Okay, first of all, kwa watu wenye ni diabetic, kitu ya kwanza tukumbuke kupiga tizi, tukule fiti. Najua hata kama saa zingine economy sipo, we manage na yenye uko nayo. Usiangalie ati daktari aliniambia nafaa nitumie ina sina. Kama unatumia yenye uko nayo. Kitu ya pili, ukunywa dawa fiti, dawa masaa, uangalie masaa yake. Alafu usisahau tizi. Hata kama either wewe huwezi hata gym, maybe tuseme kwenu hakuna gym. Road wiko. Unatoka tu at least una jog, unafanya tu tizi 1-2 boxing kidogo kama unaweza hapa pale, hata kama ni hapo kwa nyumba. At least unafanya mwili ikue hiyo activity ikue active. Alafu wana health providers. Hapo sasa ndio kuna point. At least usifuatilie sana kitabu, tukose kuingia nyumbani ground. Tuache kufocus na pale juu, na pia hapa chini ujue enda kwa ule mtu, jua anaishi aje, jua ana survive aje, at least umuguide accordingly. Usimpe limit ya third floor na hajaanza first floor. At least mpe yake, unamguide tu pole pole. Alafu message to the government, you avail us na glucose insulin, glucometers. At least prices za hizi madawa ziko a bit expensive. Watu wengi hawezi manage, watu hata wanakufa juu hizo vitu. Juu mtu hawezi akinunua mara ya kwanza, mara ya pili anapiga hesabu, ninunue dawa ama ninunulie watoto chakula. So unapata huyo mtu anajipata kwa njia panda. At least lower the prices, tuzipate at a standard rate, na hapo at least watu watakuwa wako fit.
For sure. Josephine, parting shot.
So this is to the community. It's free screening. Take advantage of it. Know your health.
Yes.
Yeah. Usigoje when complications comes. Prevention is better than cure.
Brilliant.
And prevention, it's also cost friendly.
Cost effective.
And effective.
Yes.
So know your status. Kuja wherever people kutakuwa na free screening everywhere. Not only in Westland, like across the country. Yeah.
Yes. Stella?
For me, I'd say to the people with the condition, usikae tu nyumbani. For me, it pains me a lot when maybe naangalia kwa register, a client is supposed to come back on a specific date, alafu anakosa kukuja. Then he or she comes back maybe after 3 months. Na kikuja hana reason, alisema ai daktari niliona kama skari zinaenda vibaya nikaogopa kukuja. So for people living with the condition, we don't judge you. I have a listening ear, and also other healthcare providers, they have a listening ear. We understand kama ni dawa, explain it to your healthcare provider.
For sure.
So that we prevent the complications related to diabetes. Remember, you're not limited to, yani even you just finally sema you have a lifespan. Tunataka uishi and you have a testimony to many.
For sure.
Yeah, and to my colleagues out there, kindly make your clients your friends, tusiwafukuze.
Yes.
Exactly.
For sure. And in a nutshell, that's why we are here as a Young and Sweet podcast. We want to elevate the platform. So we also have a Young and Sweet WhatsApp group and a Telegram group, whereby we bring on board people living with type 1 diabetes specifically, because the support is immense, the moral support. And we are also in the process of legalizing and ensuring that what we are doing is also acknowledged by the government and other stakeholders, because at the end of the day, if we cannot do it, I feel for the colleagues about who condition now in a place whereby they are really suffering in terms of inaccessibility. So for the insulin, we'll continue to advocate for it to be subsidized or for it to be accessible. For the diabetes supplies also, and also for insurance companies to come on board and ensure that all this is part of the package that we have, because In terms of priority, I have oxygen and insulin. Anything else comes thereafter.
Yeah.
So we as Young and Sweet will be doing more and more activities. We'll be sharing more on our platforms about the WDD and then doing and more. So watch out for nutrition perspective with diabetes, especially type 1, coming soon, probably in December. So for us here, we want to say thank you, and the diabetes marathon
continues.
Adios.
Adios.